I'm Sarah Bromley. I'm a GP by background, and I've been with Practice Plus Group since 2013. I started working in prisons in 2005 as the GP, and my career has grown with Practice Plus Group ever since. I was the medical director for the Health and Justice Service line for about 12 years, and I've recently moved into a new role which looks at the strategy and how we keep moving forward and improving services for our patient population. During my time with Practice Plus Group, we've grown the number of prisons that we work in, and we've worked really hard on improving the quality of care that we provide for patients. And that really sits at the heart of everything we do in Practice Plus Group. And it's been great to see that growth, innovation, and people coming to work every day, genuinely wanting to make a difference to the lives of some of the most vulnerable people in our societies. I've done lots of clinical work as part of Practice Plus Group. It's great work. It's really interesting. You see things in prisons that you don't see in the community, and you certainly see them more frequently. You get to know people, you get a chance to understand people who don't often access healthcare. So you see things that other people haven't started to work on. You're making new diagnoses of unusual conditions, and you get to work with quite a lot of complexity as well as responding to emergencies. So there's a little bit of something for everybody. I've loved my career in health and justice. I've had the privilege of being able to extend my leadership skills, and there are opportunities within the organisation to do that if that's your thing. We're always looking to help develop new medical leaders because if we want to progress into the future, if we want to have great services for patients in the future, we need people who can think of new ways of doing things, who are not frightened to innovate and try something different in order to support patients that they look after. A lot of the work that we do is in prisons. We also work in immigration removal centres with asylum seekers, which can be very challenging and very interesting. And more recently, we've moved into looking after people in contact with the criminal justice system in the community. And again, that presents a huge opportunity to work with vulnerable people, to help them to get the care that they need, and help them to reduce their chances of reoffending in the future, preferably to keep them out of prison in the first place. I think there's a number of reasons. I've talked about the complexity and the clinical interest that's in there. But I think one of the things that we get feedback on all the time, and what I felt and colleagues, is the sense of teamwork. You're really part of a large multidisciplinary team, playing a key role in terms of looking at the quality of care and leading the team to provide the right care to patients. But whilst there may not be a whole load of GPs in each site, you're always part of a wider group of people. There's always support available, and there's real opportunity to make those changes. We're not a very bureaucratic organisation, so if you want to do something that's different, as long as it's safe and you've chatted it through with the wider team, there's a real chance to innovate and make those changes that can be so frustrating in other organisations. It's very much a can-do organisation that wants to enable people to be able to make the difference that they want to make.